Welcome, our viewers. We are here again on Civic Space TV with a special discussion on the accountability for COVID funds. I know many Ugandans have since moved on. We remember the last pandemic, which is Ebola, but like the ministry has said, Minister of Health, COVID is still here with us. But there are also pending questions of accountability as to how COVID funds were used. And with me in the studio is a special team of guests led by Dr. Zahara Nampel. Dr. Zahara is the acting principal of law school, Makerere, immediate former director of HURIPEC, the Center for Peace and Human Rights at Makerere, and that's the entity that has conducted this research on accountability for COVID funds. You're welcome, Zahara.
Thank you very much, Sarah. It's a pleasure to be here once again.
Thank you. On the left of Zahara is a Mr. Richard Kalunji, who is a medical practitioner and a health advocate. Mr. Kalunji, you're welcome.
Thank you very much, Sarah. It's quite a pleasure talking about health issues and accountability around COVID-19 funds.
And right next to me is Honorable Michael Kakembo. Yeah. Honorable Kakembo is a member of parliament for Entebbe Municipality. You're welcome, Honorable.
Thank you. Happy to associate myself with this team.
Thank you.
Yeah.
I know he has a recent assignment, which is exciting to the people, but we are discussing COVID. And he is a member of the health committee in parliament. I'll start with you, Dr. Zahara. Why are we here today?
Thank you, Sarah. And once again, thank you for honoring us with this space. We thank Civic TV for always highlighting issues that concern the citizen of Uganda. I'm coming from the space created by a research project that undertook a study on transparency and accountability of COVID resources in Uganda, which we call the TACO project. The TACO project was initiated in 2020 following the onset of the COVID, and we are in the process of concluding it. It is being implemented by the Human Rights and Peace Center, a research and advocacy unit of the School of Law at Makerere University. Why were we particularly interested in COVID issues? We start with the citizen at the center of this conversation, because the government of Uganda has ratified international instruments and agreements and agreed to respect, protect, and fulfill the human rights of Ugandans. So when the COVID came on, a lot of resources were received by the government of Uganda, both externally as well as those that were collected internally. But there wasn't a lot of conversation about the use of these resources. For the first time in my adult life, I saw a lot of local philanthropy from Ugandans, collecting and donating so much towards the cause of COVID. But we haven't had that much conversation and discussion about COVID resources. Let me start by giving you an idea about how much money we have spent on COVID. Our research reveals that about 4.3 trillion Uganda shillings has been spent on COVID in Uganda, collected both externally and internally. This was disbursed to different districts as well as MDAs in the country. Now, if you look at the health sector, that also benefited. We got money received by our regional referral hospitals. In 2020, they received 270 million shillings. 2021, they received 407 million shillings towards strengthening of treatment capacity and contact tracing. There was also a lot of money that went towards procurement. For example, we spent about 11 billion shillings on procurement of ambulances. We spent 90 billion on procurement of masks. We also spent 42 billion on strengthening or creating of the intensive care units in the regional hospitals. So you can see that there's been a lot of money coming into the health sector for COVID. You will not forget what happened in the education sector. I think we received about 14 million US dollars towards printing of educational materials. And some money went out. Some districts got some photocopied materials and etc. There was also money that has been received on the COVID stimulus package. I think it's about 219 billion. So, Sarah, when we're talking about how much money that has gone out on COVID, it is immense. There are some good things that have come out from this whole conversation. As I mentioned earlier, the philanthropy, the fact that Ugandans, when they come together for a cause, can actually pool money for a good reason. And we've also seen strengthened capacities in our institutions, in our health sectors. The oxygen plants were created. The ICU units were also strengthened. We saw recruitment of staff, especially in the health sector, coming on board. So there's been some positives. However, there have also been negatives, and there are also information gaps that for us as Ugandans, as citizens, we want to ask that question. What is the role of the state in not only respecting citizens' right to health, but also protecting and also fulfilling? So there is need to ask those questions. Whereas the government came together very quickly because this was a crisis and put together some enforcement mechanisms. They had an inter-ministerial sector committee. There was an enforcement unit by the UPDF. There were also the district task force committees. We saw, however, that there was a multiplicity of mechanisms, especially at the district, all of them running around, different ants running around, trying to mobilize things around COVID. So in that way, we had so much duplication. And unfortunately, we forgot that COVID is not the first crisis, health crisis that we've had in the country. We've had Ebola. And in our study, we went to Acholi, we went to Masaka, we did Kampala. And for example, in Gulu, they told us that, but we've dealt with COVID before. We have management structures that could handle crises, health crises. So why did we have to have another health management system coming on board? So there were queries about this being a top-down approach that was being utilized by directives coming from the top, from the president, from the minister, do this and do that. We also saw, because of this, the accounting lines that we normally use had been reallocated. So where you normally find the cow is the chief accounting officer at the district. Now we had the district health officer receiving funds and accounting for them. So actually undermining the already established structures. Where we had the district chairperson being the leadership at the district. Now we had the RDCs and the RCCs taking the lead. So we had multiple reporting and leadership lines, and there was so much confusion and katogo. And in all of this, bypassing procurement procedures, because everybody was saying this is a crisis, we need to get this done. You know, so many tenderpreneurs, people coming in to create tenders and all that kind of mess. And then, of course, there are problems with the delays in disbursements of the funds, but we have not had much about the accountability. What has come to Parliament, and I'm glad that Honorable is here, is a post-mortem of an audit report that was done by the Auditor General that now has come to the COSASE. We would have wanted to see something that is more, direct and in time, say, okay, as Parliament, we have released this amount of money, what is it going to do? So those are some of the issues that we are trying to bring out in this project, and also trying to enhance citizen involvement and participation to ask questions. And during our project, we went around the different districts, and asked questions over the radio, prompting people to start calling on their leaders to say what is happening with COVID, despite the fact that the first big wave has passed.
Yeah, thank you, Doctor. And maybe before I go to Mr. Karunji, I would like to know, why do you think accountability and transparency is important for the public?
Thank you, Sarah. As I mentioned earlier, the citizen is important, is the first person to whom the government owes a responsibility. Every time the government of Uganda takes a loan, for whatever reason, and in this case it was for COVID, the citizen at the end of the day is going to bear the burden. The citizen is going to pay the taxes to repay this loan. So at the end of the day, the government of Uganda owes it to the citizen of Uganda to know what is happening. How much have we borrowed? How much have we received? How much have we spent? And how much have we spent it on? By keeping the citizen, in the darkness, is failing to fulfill that obligation of protecting and fulfilling the obligation as the government of Uganda to the citizen of Uganda.
I hear you, and I would like to hear from the people in the trenches, the health practitioner. What happened during COVID? Did the taxpayer get value for money? And if you don't mind, as Dr. Zahra was talking, I was like, okay, but wait a minute. Even simple things like, where did the Coca-Cola jerrycans go?
Yes, yes.
Even the bread.
And Tampeko mugs.
Yes.
Cooking oil from Bidika and the eggs from Ugachi.
Food in quarantine centers.
Yeah, Sarah, I think we're handling a very pertinent topic and a very important discussion. Many times when they talk about transparency and accountability, many times that accountability and transparency is demanded from us, the medical practitioners. If I'm a medical doctor, like if you get a medical doctor like myself, and I'm in a hospital, say regional referral hospital, like she has been saying, and at the national level, someone is saying that the regional referral hospitals have been supported with so much. The ICU facilities are now working so well. They have spent so many billions on ambulances. Sometimes that is simply as much as it can be talked about. But it's important to compare it with what is actually happening on ground. But before I go into all that nitty-gritty of accountability and transparency, we need to understand that, first of all, for you, because healthcare is a system, it must work in some kind of organized system. So if you asked a Ugandan, or even if I asked any of you who is on this platform today, how you can define, or if you can tell me where you could go for which disease, which hospital offers which service, perhaps you may not know. And these are, you're perhaps part of the elites, the educated Ugandans. So for my mother who is in Muvende, if she sees Muvende Regional Referral Hospital, what does it mean to her? Is it a big hospital? Does it mean that if she went to a health center for it will be less? But I want to tell you that going by what I was saying, sometimes when I'm a doctor and I'm sitting in a health center 4, and the health center 4 on paper is supposed to have an operating theater, it's supposed to have 2 doctors, it's supposed to offer care to mothers, cesarean sections and all that. What we actually have on ground may be different. The other day there was a very big story that broke out of a patient, pregnant mother, came in bleeding in pregnancy, was rushed to Mukono General Hospital. This is a hospital, and by all definitions, you'd expect a hospital to really be a hospital. And this hospital had a general practitioner who fought through the trenches, like you are saying, and managed to do whatever he did and sent the patient to Kawempe Hospital. Now, Kawempe is a national referral hospital by name. The patient shortly after was sent to Mulago Women's Hospital because Kawempe National Referral Hospital could not have proper ICU care for this patient. So when Dr. Zahara talks about all these good things, what she calls positive, ICU, ambulances, in which kind of system are they working?
Scans.
Exactly. Can you actually draw them out? I'll give you another example of recently when we had a very big conversation around the CT scans that came in. And I saw on our medical platforms, one of the conversations that was coming in, what kind of model have they brought in? Is it the best model? And those were the conversations coming in. But these conversations are being led by people whose day-by-day practice is actually radiography or radiology. So if a radiologist does not know which kind of CT scans are being brought, and these are the radiologists who are going to be pushed to these facilities, or if you put a CT scan in Kavale Hospital, is there someone going to use it there? So I don't want to go so much into that conversion, but what I'm trying to build is which kind of system is all this money being pushed into? Sometimes you see our politicians and technical people acting like they are on pressure to spend some kind of money. not so much on pressure to improve some kind of system. So if you take COVID-19 as an example, for us who do a bit of work in public health, we believe that you need to spend a lot of money in community diagnosis and understanding the problem or the challenge. COVID-19 should not push you into throwing money at things like I've seen with the parish development model where money is being thrown into circles. I know the OMP will perhaps give us more information. So, but you need to ask yourself, if you gave money, for example, to this circle, what is the end game? When does it happen? How does it happen? I'll assure you, none of these regional referral hospitals, 16 as they are, has a proper ICU facility. If Kawempe National Referral Hospital doesn't have, or if Kawempe National Referral Hospital must send a patient to Mulago Women's Hospital, which is actually semi-private, perhaps sometimes even charging much as much.
I've been there.
Yes, much as the money almost equal to what I would pay in a private hospital. So which kind of health system are we dealing with? Is it for the parliamentarian? Is it for the Minister of Education and Health? Is it for the common Ugandan? So back to the figures. If we look at COVID-19 as it was, what were the major issues? Number one is COVID-19 is going to kill people, so protect the people. And how do you protect them? You protect them with number one, information. So I've been reading the report, the first report that came out from the Ministry of Finance and Economic Development. I think it's the Budget Monitoring and Accountability Unit. And they're talking of monies that were spent into sensitization, into buying of masks, like you are saying. By June 2020, just about, I think, 3 months after the announcement of the pandemic in Uganda, Parliament and I think Cabinet had already swung into action, throwing too much money into the public. And all these development partners were already throwing money into the public. If you're working in a system where these things were actually very well targeted, today Uganda would not have the same health system like it had 3 years ago. But if I asked you, if you, for example, you went to a health center for right now, what kind of care can you receive? If you went to, if you
Actually, I want to ask you a specific question on that. As a health practitioner, can you tell Ugandans? Because we thought the money pumped in hospitals for COVID would help, you know, rejuvenate the health infrastructure that was dilapidated.
Yes.
Can you mention 1, 2, 3 dividends that a Ugandan taxpayer has got out of COVID? Do we, for example, have a national ambulance system? Where did the donated vehicles go? Do we have, and there were pickups purchased for COVID?
Yes.
Can we say clearly here that every district in Uganda has now a vehicle that at least transports patients like an ambulance?
You know, when you're talking of systems, you talk of players and you also talk of outputs. In terms of players, the Ministry of Health as a player took center space in this area. So much that I don't know if they were sitting in meetings and sitting with technical people like they were telling us and coming up with a proper direction. But you know, among the players, there's also the public, because the public had prevailing problems or prevailing challenges. So as you address the COVID, which is a new challenge, you need to address it alongside the other prevailing challenges. If you throw, like I've said, one of the biggest benefits perhaps that you look at is if you procure equipment like we've seen, how is this equipment going to support the other diagnostics? Because I know that UVRI, Uganda Virus Research Institute, and other laboratories really did a very good job in terms of diagnosis of COVID-19. And I think they also supported building remote and upcountry centers as well. But then, as you do that, what is the aftermath of that process? How do these facilities pick into this expertise? How do they pick into these funds that were flowing all over the place to support basic screening of diabetes, of malaria? The other day I was in Bugweri in a health center 3, and the only thing they can test on a patient is malaria RDT. So this is a patient who has come in with fever. If malaria is positive, then it may be positive with another disease, but the health worker will perhaps have 2 options: to treat malaria alone or treat malaria and any other thing that it may be coming with, because they can't test other things. So that's the system we are still dealing with. The other players that we have is the health workers themselves. In the COVID-19 pandemic, you saw medical workers crying out for allowances. If you looked at the report I was talking about, from Ministry of Finance. You see those funds being pushed out. And this is not so different from what usually happens with medical intern doctors complaining that they have not been paid. And when they usually run between 3 ministries or among the 3 ministries. That's Ministry of Public Service, Ministry of Health, and Ministry of Finance and Economic Development. And they'll be told, that money was released. Or Ministry of Health told us this and that. So sometimes there's lack of coordination, even within the cabinet itself. That if Ministry of Health knew the health system as it is, it says, I have so many health center force, you're supposed to provide this. I have so many district hospitals, you're supposed to provide this. Because I've visited some of these other health sectors or systems in other countries, and if you could benchmark on them and come to our country, if you made health center force work, district hospitals work, regional referral hospitals work, national referral hospitals to work, so much that even the Honorable Member of Parliament can use those district facilities or those regional referrals, then this money would make good sense in there. If you talk of an ICU in Ginger Regional Referral Hospital currently has ICU equipment, kudos to the ministry, which is not being used. It has ICU equipment in a store.
Why?
The challenges could be systemic challenges because it is usually 4 things. You have the supplies. The supplies must occupy a space. That space must be run by staff. And then those staff must work within a defined system. So if you're going to run an ICU, you need people that are going to run it. You need the system, the Ministry of Health, the parliamentarians, to know that we have so many ICUs that are going to support people this way. They're going to need so much money. They're going to need so many supplies. We've just had an outcry recently of supplies running out. I think we even read stories of Toro Hospital being shunned by patients, or national medical stores being blamed, and then the blame perhaps goes back to Ministry of Health. So we are playing some bit of picky-ponky on health provision. So the point I'm making here is, if we have all big money, you can even invest $20 billion US. I know sometimes money is too big to even be said in Uganda shillings. So sometimes people will say we spent so much $1 million. But you can spend so much money, but if you don't have a system which can be predictable, which can be defined even by the most illiterate of Ugandans, because if you're addressing challenges, you're supposed to address challenges for the least privileged person. If you address challenges for my mother or grandmother who lives in a village that can't afford a malaria RDT test or a complete blood count test or a follow-up package for diabetes or hypertension, even if you threw so much dollars at their regional referral hospitals, they will not access it. Because my mother who is in Muvende must go and get a blood pressure measured in Muvende Hospital, but Muvende Hospital, which is a regional referral, cannot offer further follow-up tests for her diabetes, for her hypertension. So she must move 140 kilometers away to Kampala to address these tests. And this is money spent, this is time wasted. Currently, Muvende Michana Road is pathetic.
Okay, now that you're going on the roads, let me first get to our MP. Honorable Kakembo, do we need to change our accountability systems, or are they working?
Well, this is a very sensitive topic, and I want to thank my sister here and brother for joining us. We have said it over and over again. Probably it is the system that lacks political will to do the work. In Uganda, we have a system where the appointing authority is the president, and the president has too much work. The system can work with a president who has vigor, who is very smart and strong, and willing to say things more. In a situation now, we have the president. I don't want to say he's too old, but of course he has, age challenges. He has more vigor to run the country. And the will, I say this because this is me saying it. Because nature demand is so. The doctors can tell us.
Yes.
At my age, whatever I'm doing now, in 20 years to come, I may not be able to do them. So that's the fact of life.
Yes.
So now,
We can't run around like
yes,
youths.
now if you look at President William Museveni in 1986 when he had just come to Uganda, things were different. Because he was very strong, he was very keen, he was following it and everything. Now, he's growing older and weaker. Many of the things are done by the mafias around him. And you know what they're doing now? The State House is being turned into some kind of a dealer house.
Clearing house.
Clearing house for the deals. Whoever wants to do this, whatever they bring to him, he takes, okay, he will take it up without, you know, looking at it. So, you know, scientifically. Leaving that, as Parliament, we have done our work. And I want to thank these entities that have come on board to do some accountability for some of this. Because Uganda need accountability. As a government, we are under obligation to account for whatever money we spend.
True.
And our people must see the repercussions, I mean the effect of their money, because at the end of the day, it is them who are going to pay. Either to pay in terms of paying back the loan we have taken, or they are the consumers of the services we give. Now, COVID opened many eyes, all of us in Uganda. If you had a good administrative system, COVID had brought in another opportunity for Uganda to prepare in advance, to be able to manage any emergency that can come, like now the Ebola that came. But what do we see? Ugandans, companies, you know, they came out to fight, and you wanted to help government. That we can see the government is in dilemma. How can we help? You saw how people were donating money. But the government could not see it important to show accountability for the money given. Many companies came out, they gave out food, gave out money, others donated vehicles. But then the president was like, I don't need ambulance, I need pickups, double cabins. Really? In a situation of managing a crisis, a medical crisis, that we need ambulances? Maybe came from the president himself.
Maybe we are
that
going
I
for
need
elections.
A double cabin that is 4-wheel drive. Can you imagine? He even went ahead to give specifications
for
of
COVID
the
or
vehicle he
elections?
wants. Was it for COVID or an election? Why a 4-wheel drive? Were you going to the mountain areas of Kisoro, Kabale, Kanungu? You know, those had to go areas. So you look at the motive of, you know, the president, and so many questions are left unanswered. Really, if the president had a political will, now I'm going to manage COVID, would you ask for an ambulance, or you would prefer a double cabin pickup 4-wheel drive? For who? For the RDCs to go out and supervise his election campaigns. And that's the problem we have. That's what I'm saying. We are lacking a political will. In our local language, we say that fish rots from the head. So the problem we are facing, Ugandans, are not coming from anywhere. They're coming from the head. That is the president, who is the fountain of honor, the person who has all the powers. Is the appointing authority. Is the way we report as members of parliament, including these entities that come up with this kind of investigation and write reports. They give recommendations. Where will the recommendation go? It's the president, because as we make our recommendations, we expect the president to take them up in good faith and take action on them for the good of our country. What does he do? He does not seem to give a damn. Parliament, we did it. I'm a member of parliament. I was lucky. I was selected to be part of a selection committee that went to probe the money that was spent during COVID. We traversed Uganda. We had quite a number of witnesses, and they gave testimonies. We went to hospitals. I'm telling you, Parliament appropriated enough money for this. In the first place, Parliament, the 10th Parliament, they had appropriated over 100 and something billion for vaccine, for COVID vaccine. In our investigation, we realized it was government has never purchased any vaccine by them. Most of the vaccine we're using in Uganda were donations from, you know, good countries like America and others. Now we came down to ask the minister. We are seeing Minister of Finance releasing these billions to some account. Probably central medical stores. Where is the medicine? Central medical store were denying. They've never seen anything. And the records were very clear. Money was transferred from Ministry of Finance to some account. And we're wondering, which account is this one? Now we report to the president. Now president tell us what happened. Parliament appropriated over 13 billion for this vaccine. Money was released. Vaccine were not, procured. Who do we blame now? Who do we arrest? Because the president knows all those ones. He's the appointing authority. He knows the director of medical store. He knows the minister of finance. He knows the PS of finance. I mean, PS of Minister of Health and others. He's the appointing authority. What has he done? All these reports, nothing. We will keep quiet. Parliament will come up with such reports with recommendation. We recommend so and so should be brought to book. Let him answer. Let him refund the money he misappropriated. And the president will look at you. And things will go like that. And that's how far our system is getting us, in big trouble. So if we can... Now, the issue of keeping Ugandan is in the darkness. It's also a policy of government. They don't want Ugandans to know their rights. If we have a country where people can demand for accountability, for us, we have to travel outside Uganda, a country neighboring to us here in Tanzania. The citizens of Tanzania, they demand because they know their rights. In Uganda, Ugandans will ask for small walaji when they see a member of parliament, for example. And when they see the president, for them, they expect the president will give us something dogo. And that's not by accident. The president designed this that way to monetize the politics. So politicians, Ugandans believe in money. You will give us something small, we vote for you, go to the office, and they will never ask for any accountability. And it's the disease that is eating this country. And the president, they're enjoying it because they're using the same money, your money, and they bring it back to you in form of bribing it for the vote. And then they go and eat other money, and nobody will ask because you don't have the moral authority to ask somebody who bought you to vote for him for service. And that's where we're having a problem. The political system is rotten. With corruption, they don't want anybody to know. Ugandans would be demanding from the president, we need this, medical services. We appropriate money for 21 isolation centers in Uganda as parliament. We went to Nambole, it was not functioning. We saw beds and nobody was there.
They bought tents which were swept by the wind.
Swept by the wind. And that's the country we are living in. We went to Naguru. It's a referral, part of, I think, Molago, or donated by the Chinese. You will correct me, probably. Yes. And we entered into some so-called isolation, intensive unit. Which intensive unit was not operational. Reason? They don't even have manpower. Are you seeing how the government is poor planning?
Yes, but
costing all of us.
Honorable, before you conclude, if you are out there might be wondering, are you toothless?
What I'm saying, the system makes us so. Because as members of parliament, our hands are, we are limited, of course, by law and by our rules of procedure. As members of parliament, we are here to advise government because we are a system of government that has elements within it. We have the legislature, we have us, the members of parliament, we have the executive, that's the president, and then the other side of the lawyers. This one knows them. Then how should we relate ourselves? We should be relating functionally, all of us. But the system is broken somewhere. Someone intentionally breaks off. We don't want to listen to the parliament. That's why they manipulate parliament. That's why when you see the president fighting so hard to make sure either the speaker is his person. He puts a lot of money to make sure he has the majority in parliament. For what? For manipulation. Now you can see we have a system that has been highly Musevenized. That's the parliament. And all the members of parliament will ask, what does the president say about this? Just imagine that. What is the president's say on this? If the president says yes, then it will be. If he says no, so it will be a no. And that's the problem we have. So if we can wake up.
Honorable, I strongly believe, before we let you off on parliament, I strongly believe that the idea that parliament is advisory is self-created. Parliament has an appropriation and oversight function.
Right.
Why the two? You have power to allocate expenditures of public funds. You have a power to check whether there is value for money on the public funds.
Yes.
The framers of the Constitution envisaged the situation Where Parliament can say, Minister of Health, you've not accounted, we are not discussing your budget. You have no budget until you account for the previous one. What stops you from doing that?
Very good. Now, as I told you, the president tries hard to make sure that he manipulates Parliament. How many people will say what you're saying of Parliament? As opposition, we are less than 30%. We are over 528 members of Parliament. Out of the 528, opposition, including NOP, FDC, UPC, and DP, we are less than 150. That means the 300 and something are for the president. So you know where power rises. And the politics is a game of numbers. Whatever you do in Parliament, the highs will always take the day. The highs will have it. And that's how we do our work. Parliament appropriates money. Then the Minister of Finance, together with the Permanent Secretary of Finance and the President, they do the release of funds to those different entities where we have appropriated money. We have seen a scenario where Parliament appropriated money and the Minister of Finance tells you, we had no money, so we did not release money. So whatever appropriation you're talking about stays on paper until the next financial year. Because the minister tells you, we do not have money for that. We have raised it, but the powers to say we are not doing that, then the speaker will tell you, let us put it on a vote. And the majority, who are the NRMs, will tell you, for us, we are supporting President Museveni, and they will go to Chankwanzi, and they will tell them what to do. They will come back very happy, and at the end of the day. So we should know where to touch. If the president says yes, all this kind of report, if you can get an interface with the president and you tell him these facts, probably he will understand. If the president understands, the rest will be automatic. But if the president fails to understand and is left in the hands of those few mafias around him to feed him everything, the president, if he fails to understand what we are talking about, it will not move, because always the president's word is final. So if you just imagine, if it is final and it's not in good faith, the end result will be the same. So we just need to understand the system we are working under. As Parliament, we are doing our best. Imagine we did our report on COVID. And we reported each and everything, including the companies that were testing at the airport, at Mutukura borders, and in other areas. And the discrepancy in the cost. At Mutukura border, it was a different cost. At the airport, it was different. For the foreigners, it was different. For the local, it was different. All those were we reported, and we gave our recommendations. What happened? So the minister was like, we are touching into, is ATM machine. And those are the companies. Most of them were belonging to the minister, a Cheng, Jen, whatever. You see how the mafias are operating. They are very dangerous. Sometimes you can call your members of parliament that want to do something and say, please, you stop. Don't go into that. You don't know what you are doing. Right now, I'm probing NSSF. But that's the same report we are getting. You see, we have a system that has somebody who is above the law, too strong, and all of the people around him. Now, when we look at the recruitment system in Uganda, do we have people on merit? That would be the starting point. People are employed because you're a son of somebody, you are my relative, you're my friend, They don't have these jobs on merit. So they don't give a damn. Too much, they don't waste a lot of their time into the services. They know I am untouchable. I was brought here by a minister, by the president. My father was a good friend to the president. So they are free to use the money the way they wish. They will have a lot of poor planning. Because if we plan it so well, Uganda has a lot of money. We have so many well-wishers who are ready to give us money. But this money is misappropriated by those people who think they are too big for the law. And the president does not come out to bite. So when I bring in the issue of political will, that's why the president will be biting. Because if Parliament has pointed the finger at my brother here, that you have taken money, and the president take serious action against you, that will be enough for us. So Parliament can be empowered by none but the president himself and the executive. If the president can empower Parliament, Parliament to go out, they probe. After probing, they report to Parliament. All the recommendation we give, then the president tomorrow will be, held accountable. Tell us, Parliament recommended you to do A, B, C, D. What happened? We are seeing ministers who are censored one time, and they are here, they're still ministers.
Let
That's
me
the
move
government we have.
to Dr. Zara. It seems we are on our own as citizens.
And for God, each man on his own.
If anything was revealed to us as Ugandans through COVID
Yeah.
It was that we are on our own.
It is,
Because,
indeed.
as other speakers have said, there is no system. Or the system that is there existing is working for the interests of a few.
Now, some more information
Okay.
on this one.
Yes.
COVID. Many Ugandans came out and he donated. And the president was so happy. I had him on radio reading out donation coming in. No Ugandan has ever demanded for an accountability. I have never seen a sack
But if
of,
you demand for it,
of
they
maize
say you're
flour written on
anti-government.
anybody. I don't know where that the posho, the rice, the cooking oil, the eggs that were donated, and the president came out and announced them on radio. I don't know anybody who can bear us witness, who can stand here as a witness to tell us that he has ever seen a jerrycan of Bidiko cooking oil in somebody's home from the State House.
Yes,
for COVID as a
yes,
relief.
but the reason is because there is no information that after that donation, this jerrycan of cooking oil has gone to Muvende
That's
Hospital.
what we want to know.
Yes,
So how will the
actually.
All the
Ugandan
mattresses
ask
that you were
for
given by Eurofoam?
how will
what?
the Ugandan ask for this mattress?
Let's first start with Dr. Zahara, because I wanted to ask you exactly on that, the information gaps. How do we deal with that? And what are key accountability concerns pending today on COVID funds?
Yes, and as I was saying, that information has to come from somewhere. In order for Ugandan in Mubende to ask about the food in the quarantine center, which was donated by Bidco, the cooking oil, there must be information that's coming from the top to say that Mubende, Gulu, etc. have received this number of jerrycans, which are going to be in the quarantine centers. But that information was lacking.
And the motive is not clear.
And I think if anything we learned through COVID was the fact that there is no system really. The system that is there is working for a few individuals. Actually, as Dr. Kalunji was saying, the system that is there is so damaged that even if you pumped how many US dollars, there are too many leakages. You know, there are hemorrhages everywhere leaking. That is why money was being paid to individuals' accounts rather than to institutions. Of course, they claim this is a pandemic, it's a crisis, we have to do all that we are doing. But now with the information, I think there is the issue about the fact that there was a top-down approach. When all these things were being done, the decisions were being taken. For example, local governments were not being included. There was no consultative process that was building from the ground upwards. Directives were coming from the minister and the president, you know, do this and do the other. So there was no involvement, there was no ownership, and there was no information flow coming from the top to the bottom. And that also created an opportunity for those persons to take advantage of COVID. COVID became the opportunity of the decade
But now
for people.
You are analyzing the militarization of COVID management.
Not only
And
that.
I remember the president clearly declared that this is a war. And that's how he put in RDCs in charge.
Yes.
It was,
He was fighting Kony.
security.
It was fighting as an enemy.
Yeah, security was at the
Yes.
forefront of
And that
COVID
is why
management.
there is
was a
the
classified
incident.
account.
The incident
Classified
management
money.
unit was one of the units that was created as part of the structure. The Interministerial Sector Committee, the Incident Management Unit headed by UPDF,
Yes.
and then the District Task Forces. The Incident Management Committee
By the RDC.
was very, no, there's a commander.
The other for the district.
Yes.
was the RDC.
Okay, and then we had the one at the district that was managed by the RDC. A lot of power. Actually, when we're doing this investigative surveys at the district, the security personnel were very well facilitated. They were happy. They received the bottle of water per
More
day.
than
They
doctors.
were paid. The village health teams, on the other hand, were not paid. Even now, I think there are still payment claims
Serious.
that are coming in. But I think it is because somebody took opportunity of that and politicized COVID. So you find that it was actually a political, campaign, a mobilization, rather than a health issue. It became a political entity headed by RDCs, headed by the RCCs. It was actually something that we failed to take advantage
There
of our
was a
technical
COVID
people.
center at the police headquarters.
Yes. So rather than having these teams, yes, rather than having these teams being led by technical personnel, we had the teams being led by the political people. So it became a political matter, and remember that was the time that we were going into the what? into the election. So it was an unfortunate thing that we did not learn the lessons from COVID. Rather, we are still paying, and we are going to pay for a very long time.
My second question, what are some of the key outstanding accountability issues?
Okay, so one of the things that we discovered was that there was a lot of waste. Too many leakages. Right now, we don't have a proper comprehensive audit report. Yes, we have something that has been done by Parliament, but even that which has been done by the Auditor General has missing information. When the report came to COSASE, and COSASE was asking the members from the Auditor General, what about this? What about this? They also did have answers to it. So, of course, there are issues of wastage, there are issues of corruption, and transparency and accountability is lacking as a fact. But I want to draw it back to, the public and also to the parliamentarians. I believe that our parliamentarians are disabling themselves. There's the opportunity, for example, to call ministers during question time. Every week, call the Minister of Health and say, we have appropriated this amount of money. What has happened? There were late disbursements, These issues were not dealt with. Everybody ran away during COVID and hid themselves, but nothing happened afterwards. I think we need to reawaken the soul of Ugandans, starting with the parliamentarians and going lower down. Because if we keep saying that the head is rotting from the top, nobody is going to come and remove this head if the questions just don't start coming from Ugandans. So we need these audits to come in because we need information so that Ugandans can start to ask those questions. We know the corrupt officials. At least you say that information is there. The tenderpreneurs, people who got the big tenders, that information is there. The lists are there. No procurement followed. Why aren't you calling these people? Why aren't you naming them? Why aren't you shaming them?
But can that still work? Do people still have shame?
No.
Let me
Can
go
I
to...
give him information?
Okay, first give us information on
I wanted to
maybe
give
as you
some
give-
information.
Yes.
We talked about Parliament being, I think, weak and not strong enough. We've
Toothless.
tried to bite. I will give you an example. The Minister of Health, for example. And there are this kind of blame games all the time. You call the minister, says, yes, I wrote this requisition, but the Minister of Finance. Then you call the Minister of Finance, please come and tell us, Minister of Health, we appropriate this money for the ambulance, we appropriate this one for this, even salary increment. What happened? So, I'm a father, when the cake is too small, I must divide it according to the available resource envelope. Now the money was little, so I did not, send money to them. And the AI is moving just like that until the financial elapses. So the problem is the Minister of Finance, again, has serious issues. If you could, interest yourself one time to come to Parliament and see how the Minister of Finance can answer some of us. You have seen him on radio.
But
the economy is like
Honorable,
there's a lot of
the resource envelope was there because we received a huge amount of money.
It was there, but who is accountable for it? That's the minister. That's where the money goes. And he's the one who's supposed to send the money to different entities. Send the money here,
Yes,
send
but
the money
if
there.
the money
And
comes
then
in for COVID, if it
money.
comes in for COVID, so he appropriates it to other things because all children must get.
That's what I'm saying to you. Because
I think Ugandans are having really a very big dilemma, Sarah.
Very
because
big problem.
It looks like we have institutionalized corruption, institutionalized recklessness. Because the dilemma is in a so that you have a good list of items going to be procured. Ambulances, ICU equipment, masks. On paper, they look really nice. But the dilemma is in a way that we don't know why these people are prioritizing this.
Very good. The political leadership.
Yeah, so you don't know whether someone's prioritizing this because it's actually going to help you or because they are going to benefit from that list. So I know that we are going to say, why doesn't Parliament do this? Why don't Ugandans come out? But I think we are addressing a political problem. This is not a technical problem.
It's a political problem.
Uganda is not short of doctors that can run health centers and hospitals well. It's not short of technical people at the Ministry of Health headquarters.
Not short of the money.
It's not short of good policies. Parliament released 2 good reports regarding COVID. One by the popular Kantuntu report, and then the other one, the Ayume report. These two reports, if you read these two reports, you don't even need to read anywhere else.
But now the political
If
will
you
comes
implemented them the way they are,
to be
the health system in Uganda would start to be used by
So
even
are
the head of
you
state.
saying, I know, man, and I want this to be my words because I don't want to put you in trouble. Are we saying that the fish rots from the head?
That's what I said.
think I'll give you one
It rots
example.
from the head.
You've been to countries, for example, if we get our top leaders being treated
Abroad.
in Kenya, in Berlin,
They
in
can't
South
get ashamed of
Africa,
that.
why do such people still lead our health system? Because let me just say this.
It's a nice question.
If you're a minister of health,
and you want to be treated from Kenya,
if you have a health committee in parliament, which says it's looking after our health, but the same parliament is going to give its parliamentarians health insurance to take those parliamentarians elsewhere, and then these same parliamentarians are discussing how we should receive health care. I feel like we have a lot of dishonesty on the side of our leaders. Uganda is not short of expertise. If you looked at lawyers, if you looked at doctors, if you looked at engineers for roads, if Uganda sat down and looked at its policies, even not short of policies, if you looked at those two reports, if I sat with the Minister of Health and the President, and we looked at those two reports alone, because the Cantonto report that I read really page to page,
that was my
back to back, talks about the health centers, the diagnostic incapacities that they have, the healthcare, the medical workers that are lacking, and those are things I'm talking about. If you get big COVID money, look at the system as it is. Define what would COVID need in terms of diagnostics, in terms of health workers, in terms of space, like I was already saying. What in that particular area do we strengthen? If you buy 10 ambulances and they're all over the place, they're not running in any kind of organized system, you're only wasting money, and we know them.
And they will be packed in one
So we have equipment that is bought very expensively, but it rots in stores because there is no system in which it will operate. So the point that I'm trying to make here is transparency and accountability are not things that you find from people who don't want to offer it. Many times I'm on fora with top ministry officials, top doctors, and I ask some of these questions. But guys, if we are doctors in Uganda, why do we have people in Kampala that live in places that are inhabitable? You go to a place where drainage channels are running along people's homes. But we are doctors in this country. We have city health officers. We have Minister of Health. I feel like we have done a very big disservice to people in this country who are not educated. We are not showing any kind of example.
You know, and I'm sure the viewer today is thinking of Barrio Monsi.
Yeah, very unfortunate event.
Yes, who went to his constituency hospital and there was no Panadol, no oxygen, and he had to be airlifted to Kampala.
Yeah, but again, when you look at transparency and accountability, these are not things that we should plead for. It's a right. It's actually only proper. It's good manners.
Yes,
that if I gave you money,
I want to come to the way forward. Yeah. We have all talked about, we know what went wrong, what could have been done better. Can we be systematic now? For example, in the medical sector, I know that the National Medical Stores tries to share information of what they've distributed, delivered, and it helped a bit during vaccination for COVID. But not everybody is doing that. So what have we learned? What are our lessons from the COVID bad experience? What can we do better? What reforms do we need? Starting with you.
So, 3 things. Number 1, lack of proper information sharing is intentional. I've shared messages with people. If you got any district health officer, if you got any minister of health, if you got even a parliamentarian, and you tell them, but you, Mr. MP, you come from Tororo district. What is in Tororo district? What is Tororo district benefiting from you being a parliamentarian? So lack of information sharing is intentional because one side, it denies someone what they think, what they should know. Number 2, it denies them what is actually being shared or being appropriated. So now, if we could, as advocates and people who are talking about these things, if we could go out there and push these people to start sharing information, for starters, small things that would have very big impact. Because having these conversations and dialogues are good, but if the Minister of Health will still not share what is being planned, what is going to be done where, we're still wasting time with this. Number 2, the other thing that we need to look at on top of information sharing is we need to start putting people to task to explain certain things that they're supposed to be explaining. If you have a leadership, especially leadership, the other day I was listening to a speech by the executive director of Kampala. She was trying to explain how we are in this mess of potholes. And she mentioned to us the number of political leaders that we have in Kampala, over 1,400. So if you have political leaders big in number, 529 MPs, 1,000, so many, Uganda, I think, is the country that is not shy, that is not short of political leadership. But where is this advocacy? So we need to start really getting, if an MP came from a district where there is no hospital, we need to start asking them to seek healthcare in their own places as well. And I agree with the MP that this kind of push is going to be, is supposed to start decided by us, the public. So if you have an MP who does not take their children to the poor school in their constituency, but for 20 years they keep saying they're representing that constituency, the public, not that I'm inciting it, should come out and demand. But final and most importantly is, the point that I need to stress here is that we are not short of expertise, we are not short of policy documents. What we are short of is perhaps the willingness, the selflessness, and the human behavior, human feeling for humanity. That, you know, if I'm able to enjoy good health care in Nairobi Hospital, why doesn't someone from Butaleja equally enjoy 50% of that? Because perhaps some Ugandans are enjoying 10% of what our leaders enjoy elsewhere. So, in conclusion, around the way forward, as people who call themselves advocates and people like you who are running this very important space, we need to start putting these people to not just having conversations with them, but ask them, you know, there's a joke that some of our leaders usually make that, you know, one of our leaders in the medical association, that, you know, in public, if a doctor is got for stealing, say, a microscope or something, come out and say what he did is not wrong. Sorry, what he did is wrong and improper. But of course, because it's our own, we will try to stand with him in public. If you go with him back in the corridors, and this is what I'm asking from the MP, if you go with the minister in the corridors, who is your fellow MP, you tell them, I know, and Madam Minister, yes, you're our own, and we shall not really push you so much in public, but please tell us what happened to this money? What happened to this? What happened to this equipment? Why don't we work for our people? Why don't we provide for them a system that will treat them? So we can mention 100 things we can do, but I feel like this is going to be something of people trying to have a self-reflection, think about other people just like they think about themselves, think about other people just like they think about their children. If POE results are released and you're the minister, your child goes to a private school in Kampala, they're actually crying because they got aggregate 5. But there's someone who is looking up for your support in the village and they didn't even sit for primary leaving examinations. So same for education, same for health. The same way you fly to India for a general medical checkup on government money is the same way you should think about someone in Nakapipirit, in Kabale, who just needs basic screening. So when you get all this into the COVID-19 dilemma, everything that we're going to do, be it Ebola or COVID-19 or non-communicable diseases that we're talking about now, let's get whatever we are planning and the money that we are going to get aligned with the system. Don't just get money that, this money is for diabetes and then you throw around to national referrals or regional referral hospitals. First, look at the system and see how can the money for non-communicable diseases, for Ebola, for COVID-19 fit into the system as it is, so that at the end of the day, when all this money is spent, you actually have a system which is strengthened and services being enjoyed by the people.
I'll come straight to you, Honorable.
Yes.
I know, you know, among the Global Health System's latest report for management of COVID,
Yes.
Thailand emerged number 6 in the top 10 countries that had a firm healthcare system and managed well COVID pandemic without necessarily spending so much money like Uganda did. And it's the only non-high income country in the top 10 countries. I know that they have a national response authority for pandemics, among other things. So what lessons can we take from COVID?
The lesson.
What can we do? Because I didn't even know, but Thailand has an authority.
No,
like
we
the
don't
way
have
you have national drug authority.
Yes, yes.
We don't
For
have an
pandemics.
authority, but we have a
The
fully fledged
lesson
system
number one
for
is
managing
very clear
pandemics.
that we have issues with our system and the way it operates. So if we continue with the same system, the way forward, my humble appeal to the civil society, including you, the entities who come up to help us, find time and preach to the president one time. You can organize a breakfast, something for the president, and interact with the president, probably. You can invite the president for a cup of tea, make an appointment. You go with all these kind of reports. Because for you and you, you're not politicians like us. He will be biased when he sees a politician like me. You are, no, what do I expect from you? That's what you can say. They're already biased. But civil society can help us. Because if you preach the right person, that is the president. Because as per our system, he's everything. He's the Alpha and Omega. Let us begin with him. So civil society can also help us as we do that. Two, civil society can also help us to, well, build local capacity, mindset change of our people. Ugandans should wake up to some realities that Ugandans should demand for accountability. If Ugandans start demanding for accountability, instead of asking for waraji whenever they see politicians, instead of asking for bitano whenever they see somebody who is looking for the vote, they should begin asking them, what are you going to do for us? I remember when I had just joined Makerere in 1996, there was a civil organization, it was a civic education from PDSA. Some students from PG, Makerere University, they had started a civic kind of, they were educating our people. And by the way, they helped doing even the 1996 elections. They were very good, very, very visible on ground, educating Ugandans into how to vote, those kind of things. But they are no more. We don't know what happened. We don't have funders because Ugandans have a problem. You can even cry when you see Ugandans thinking the way they are thinking. They don't seem to care. Nobody can even ask the president, please, where is our, the donation we got from COVID? What happened to it? Nobody can even ask you that. Because the politicians know that we are leading a population that is so green, so ignorant, so careless. So they are free, they are at liberty to do whatever they want to do because they don't ask them. You can imagine in the villages, MPs, they just go back for votes when campaign time comes. They don't even go there. They no longer have consultative meetings. They don't interact with their voters. How many times have we seen a member of parliament interacting? Because this one is driven, sometimes it's demand driven. When the population demands for that, you will always go back and ask. But because the population demands for waraj, so people go for waraj and they give them waraj. Who is going to help us build local capacity? Change the mindset of Ugandans, including the president. The president is very sick because he's isolated in a group in a state house with a few mafias around him. And for him, he thinks that's the Uganda. So the only person who can penetrate, a neutral person is civil society. Because you have the power, you are registered, just convene a meeting with the president. Have an interface with the president. Tell the president this. You give him the report. Because most of these reports, the president won't get a chance of looking at those reports. If we can do that, I'm telling you, the president will be another person the next day. The problem, that's where it comes from. The system.
Dr. Zahara, what do we need to do differently?
I think, Dr. Sarah, you have seen that responsibility that has been placed on you.
Yes.
It's a big one. It's on civil society.
I'm here looking at
I also don't know.
School.
Yeah.
It is still with the president.
Do you invite that person?
I think what is clear from the COVID pandemic is the fact that we have a total system breakdown in this country.
Rotten system.
We have no institutions, the institutions are not working as well as they should. And yet, as you have mentioned in for the Thailand issue, Thailand was able to manage because they have a system in place. But we are not devoid of laws and policies in this country. We have them. We have a strong constitution. Of course, it's being eaten up slowly by slowly. We have very good laws. In our engagement with the different stakeholders, we also realized we even have guidelines on emergencies, health emergencies. So it's not like we don't have these things in place. But I think what is also clear is that whereas we have this good institution and policy framework, the system, the political will for it to work has also broken down. And as a result of this, the citizen is no longer at the core of this conversation. The citizen is by themselves, and then there are individuals who are also, pretending to work. Let me call it pretending to work. Unfortunately, we have a citizenry that has lost trust in the state.
Can I give you something small, information on the system? Now, when you look at the system of governance in Uganda, you find we have two people. We have the technocrats and the politician. And by the system, the technocrats are above everything. You find even the minister has not much power over the technocrats, headed by the PS in the ministry, and in local government, we have the cow. In the municipalities, we have the town clerks. That kind of system, separation of power, it brings conflict. Who has power over the other? I am appointed by the president. This one is elected.
A commission
by the
in finance has refused to return.
Yes, and they'll tell you, I don't have money. A politician will come and ask the PS, please, we need the money to do this. And he tells you, oh, honorable. For them, they are so humble, how you behave. Honorable, you see, because they, we like those respects. There is no money, honorable, you see. And that's their song. So the system that brings conflict also between the politician and the technical staff. Who is the boss over the other? Who supervises the other? That also brings challenges in the driving performance. Who is it to drive or who to perform? Does the minister drive a PS? Does the chairperson of the district drive a cow to do whatever they do? For us, we are technical because they are the senior advisors.
Because of that,
us, politicians.
Because of that dilemma, somebody stands to benefit from the fact that it is not working. So we have, for example, a system, policy framework or decentralization that is excellent. If the way we had laid out our decentralization model could work, our local governments would work. But now we have only 13%, budget going to local governments. What can they do with that? So we have systems that have been disabled. We have a citizenry that has been disempowered. And we have these persons who are actually taking advantage of this. But I want to go back to the citizen. Honorable, you said that now this is civil society, but it is not civil society. It is everybody in this country. It is civil society, it is academia, it is researchers, it is students, it is teachers. If the teachers' relief funds are not being paid, what are you doing as teachers? A few teachers are being collected to go to Koro airstrip with the head of the teachers. Politics comes in and where are the rest? Everybody, I call upon Ugandans. Everybody must play their role. If we have a white elephant in the room and we want to infect this elephant with malaria so that this malaria, they will die and we have a transparent and accountable system, all of us must bite. All of us must infect with malaria. So I call upon everybody. There is a role for everybody to play, whether it is information, whether it is capacity building, whether it is donors,
conditions on their money to be
so
very good.
Everybody has a role to play.
And you're not talking of white elephants. We have not talked of Lubowa Hospital.
No, yes,
it's
actually.
also a COVID hospital.
Terrible.
Dr. Karunja, I wanted to come
Lubowa.
to your parting shots.
Yeah, these are painful parting shots because we're talking about very pertinent issues. We're talking about a very important sector of health, not because I'm a practitioner in this sector, but because nothing can happen if someone is not healthy. So my call is really to all of us, like doctors said, but most importantly and more so to our leaders and the elites, the educated poor in charge of the health system. It is very unfair, it's bad manners, like I said, for us to pretend to be providing a health system to our people, and yet we are not doing so. We have overwhelming evidence that the health system is not working because those who are in charge of it do not use it. So if we get any other opportunity like COVID came, opportunity of course not in a good way, but if we get any other opportunity for us to get such money running to the health system or the education system or any other system in this country, I think the only way we're going to change our country is not by going to some school to be taught to be patriotic by people who are not patriotic themselves, but by coming out to say that every single Ugandan in this country deserves good services, not because they are MP or minister or educated, but because they are human beings. So in the world of fairness, in the world of accountability, in the world of offering service, we call upon every single person who is in charge of any docket in this country to think about the Ugandans, to think about their role as a role of changing someone's life, not as a role of owning a mansion or a Land Cruiser. Thank you.
Thank you very much.
Let me ask
Dr.
a question.
Zahar.
Yes. If we passed a policy as a country that no one is above the law and no one shall use public funds to access health facilities as a policy, if we pass that, if you want to go to India as a judge,
Use your money.
use your money.
They will steal it.
If the president
steal it.
can
If we
come
had
up
a
with that
policy,
order,
if we had that
directive, it will
directive or
work.
policy,
That's what
we
I'm
did
telling
change
you.
the health
He
system in
can't-
this country.
Remember a new president.
Do you know what he has just said?
A new president.
No member of
maybe,
parliament
not
should
this
fly
one.
out.
Are you fried?
We are no longer, because the president said so. No trips. External
Okay.
trips.
So let me, Doctor, your parting shot.
Yes. No, I really just said that.
That we no policy. The
yes,
policy that
let's pass a
nobody
policy.
We have the
nobody
policy.
goes on treatment.
Yes.
But
I'll
if
use
policy-
public
if
funds.
policy say without the
Let's
political
start with
will
that,
will not
just
work.
that one.
We have quite a number
And
of
see.
policies on papers. If they don't have any political will to drive them, they will not work. So the president has issues. I still insist we need to visit the president and have an interface with him.
Honorable Kafera, that's your parting shot? Or you want to add something?
No, I don't.
Please
want to add
conclude
more.
to the viewers. Conclude to the viewers.
Well, my conclusion, one, I want first of all to thank this team and the Space TV for inviting us to come and share with our people. These are our views, and we feel they're pertinent. They can help us change our country because we love Uganda. That's why we're wasting a lot of time here. We need to make something, at least to see a change in our country for the good of all of us. I want to thank you, and probably the donors who give us, of course, facilitation to have this one in place. Yes, I want the president, again, I want to insist, if we can have an interface with him, let us not leave the president to politicians and the mafias, because they will influence him according to what they want him to do for them. Let the civil society wake up to this reality, at least for once, to visit the president and have an interface, have a cup of tea with the president. We tell him without fear of favor. Probably, if he wakes up today, the president tells you, I don't want to see any minister going abroad for any treatment, and it's the president, that will be a presidential directive. You never see any minister flying out, and you will see them fidgeting around now, to make our system work a little bit. But if we still have the same, even ministers who have schools, how can they manage the Ministry of Education? They're in private practice, they have their private schools, very expensive schools, and now they are the minister managing the education system for the government. Do you hear it? A doctor is having a powerful hospital of himself and is now managing a public hospital for the government. This kind of conflict.
they
we need
collapse
to.
them to
So if
then
the president comes out and says, yes, they will, that is the intention. They are creating customers for their own business.
I am laughing. President Ruto declared recently that all his children are in public schools.
Yes, we
and
begin
he
from that.
cannot take them to private schools because public schools
No.
should work for
Let me even
everyone.
tell you, I am a
Yes.
member of parliament for Entebbe. I have 8 of my kids. They all study in Entebbe schools. I told them, I'm a member of parliament here.
Okay.
I can't take my kids outside Entebbe. They're in Entebbe, in a public school.
I think
And we fight.
our time is up. And
We should begin from there.
I was really looking at the proposal by the minister and challenge that civil society should have an interface with the president.
Yeah, a cup
And
of tea
I'm
one
thinking,
time.
okay, so how many people on social media would use such a picture to say civil society
Exactly.
has been bought by the president,
It will never be bought.
through our toxic politics. But that's a conversation for you and me to continue, and it's our duty as citizens to call for accountability.
Great.
Till next time, bye-bye.